Thank you for coming to the presentation. Today we're going to be talking about some laser-based therapy. How many of you have seen any of the laser therapy at the convention so far? Going to come by the Erchonia booth. We'll be over there afterwards. I'm going to talk a little bit about what lasers can do, what we can do for fat, and what we can do for pain, and what we can do for overall function, and some of the stuff that we're doing for research. Okay, so really it's just kind of an introduction to the way medicine and healthcare is changing a little bit, and how it's kind of starting to combine. And maybe some of the medications are being, I would say, facilitated in regards to what they can do with laser-based treatment. So without any further ado, I'm Dr. Brock. I am from Dallas, Texas, and we'll be getting going. This is our emblem for our emerald laser. I'll be talking about this pretty extensively as we go through this a little bit. This is the green light that you'll be seeing. We'll be talking about that. And what are all the things that lasers are doing? I've only got 45 minutes, but I can talk for 2 days just on this one slide. And this is the most important thing that I want everybody to understand. We kind of live in a society right now where diseases, outside environmental pollution, injury, all these things are creating situations where we are losing the ability to make ATP. So here's the quiz question for the day. How many pounds of ATP do we make in one day? ATP, the thing that gives us energy, that allows us to survive. We make our body weight in ATP per day. So the question is, are you making your body weight in ATP per day? If you have disease, if you're sick, if you're malnourished, if you're not doing something to facilitate that process, you'll lose 1 or 2 or 3% every year. After the age of about 30, you'll lose about 2% just naturally for the rest of your life. But if you're unhealthy, then you'll lose more than that. So with laser-based therapy, we know through the research, and the research is really extensive. One of the things that I do is a lot of research. And we know that the laser-based therapy is helping the mitochondria in the cells make ATP so that tissues can survive. And that is the most important thing. And then we can actually manipulate the frequencies of these lasers and actually make them do specific things. So if we want to activate a part of the brain, if we want to do something to open up fat cells, if we want to do something to reduce pain or to actually increase wound healing, I'm going to show you some stuff. It's just different things that we do with lasers, okay? So the biggest thing is it stops inflammation and it increases energy, so it helps tissues heal and it stops pain, and then we can actually change the way the laser, the frequency of the laser and gear it towards a certain activity. We can go through so many things and it does so much stuff. It's really replacing a lot of things in regards to modern medicine. Right now, we have a big crisis in regards to using pain medications. We really can't prescribe them the way we used to. And so as a result, we have to have something to take its place, and lasers have done a very, very good job. Now, this is one of those scary pictures that everybody might have learned way, way back in school. This is just a really simple picture of what we've been doing for the last 20 years in regards to research. So when people think of laser, what color do they think of? Red. But then we have violet and we have green. And we have 4 portions of the electron transport chain. So as we do this, just remember, energy has to come in. It goes through complex 1, 2, 3, 4, and then over here it makes ATP. And we have to make our weight in ATP per day. Remember that, right? So if this thing breaks down, we don't make energy and our body starts to deteriorate. Tissues will deteriorate. Or if you're injured, it won't heal as quickly. Or if you have some sort of other environmental pathology, it'll start to destroy some of the cellular tissue in your brain, in your organs. So we're using lasers to preserve people while they heal. This is really revolutionary because there is no medication that does this. So that's the important part. So we know that there's different supplements, but we know that also our violet color, it's at a 405 nanometers on the spectrum of light. It's violet, okay? We'll just say it's violet. And we know that violet is really important because it activates the first 2 complexes of the mitochondria. So without violet, we really can't get the 2 rate limiting steps, the very beginning of making energy. It doesn't work very well. So the addition of violet in with our red has made a huge difference in regards to what we can actually do with a laser, okay? And the lasers that we're using, I need to make this very clear. These are not weapons grade lasers. They're not, it's not about the heat, it's not about the power, it's about the electron volt. So you don't really feel these lasers. The lasers that are really hot, they really actually activate surface water molecules and it causes them to vibrate. It lowers the penetration so we don't get that deeper cellular response. So we have set them perfectly at the amount of electron volts to get really good penetration. We know this through really good research. But every time you are around a pesticide, an insecticide, diabetes medications, or over-the-counter anti-inflammatories, you're shutting down complex 1 of the mitochondria. So violet helps turn that back on. So it's really cool because a lot of people are taking these over-the-counter medications for pain, but it's really slowing down the electron transport chain. It's doing it in their brain, it's doing it in their kidneys, and it's doing it in their intestines. And this is why some of these non-steroidal medications start to do what? Destroy your kidneys and start to do things. They stop inflammation, but over time they actually will start to deteriorate tissue. So we use lasers to actually help with pain. And this is like the beginning of Parkinson's disease. When complex 1 gets destroyed, it starts to create such breakdown in cellular function that the cells that make dopamine, they don't function anymore, and you get Parkinson's disease. So we have noticed that we do a lot of, at least in my practice, we do a lot of neurological therapy with laser, and we have done very, very good at reducing the amplitude of tremor in Parkinson's disease. The other thing we've done is we've increased gait. Most Parkinson patients that shuffle really badly, so we've increased their posture, and we've actually reduced the amplitude of tremor with the violet and the red combination. So with neurological stuff, we're doing a really good job on that. Anti-cancer medications will come over here, they'll shut down complex 2. Antihistamines will shut down complex 2. But our essential fatty acids, and I just throw some nutrition here because I think it's fun. Some coenzyme Q10, which most people can get a hold of, really helps complex 2 stay alive. But violet is also the stimulator of the second complex, so 1 and 2 stimulate. Again, cancer medications and food allergies will shut down complex 3. Our green 532, you'll see if you come over to the Erchonia booth, green is what we use a lot for body contouring, for opening up fat cells, which I'll show you some real-time video of that here in just a second. But green also is really good for connecting the first two and the final component of making ATP. It connects it together and it brings the whole equation together. So if we go a little bit further, red activates these last 2 complexes. So we use our violet for the first 2, red for the last 2, and then green connects it together. So after about 20 years of research, we found out that red was really good. Cleared for pain and all kinds of stuff. And then we're like, what about violet? Violet is anti-germicidal. It kills things very well. We use it for antimicrobial function just all the time. But red connects the first 2 to the second 2, or red is the second 2, green connects those 2. And so when we get red, violet, and green together, the whole thing lights up and it brings the mitochondria to threshold and cells start to resonate and heal. And we see it time and time again. I'm going to show you some stuff really cool. So I put references on all these. If you want to see this animated, you can always go to the YouTube channel and watch that. So here's a patient that came in to see me. Does anybody recognize what this is? What would this be? It's a keloid. So how do you think that she got this keloid? Ear piercings, exactly. So, and I just want to reference the tattoo behind her ear. Does anybody know what that is? She doesn't either. It's a dolphin. Okay, I'm just letting you know. I want to show you that just so you know it's the same patient that I'm actually doing this on. So she comes in to see me. Her insurance is not going to pay for this to get removed. This was right at the time period where we were wearing a lot of masks. And so every time she takes her masks off, what do you think it does? It keeps hooking on it. She has a 2-year-old child, and her child doesn't want to come near her because the child thinks that it's gross. Okay? And so she's like, I want this off. Now, what's the problem with cutting off a keloid? It grows back. So I just said, hey, look, I'll take off your keloid, but you have to do everything I tell you to. So I've got a couple of friends that are plastic surgeons, and they're like, you cannot cut this keloid off. I'm like, I'm gonna cut it off. And so they said, okay, it's gonna grow back twice as big. I'm like, no, it's not gonna do it. So we all had a big bet going on. So this is after the surgical process. This is about 2 days afterwards, okay? Now, you see the tattoo, you know it's the same person, right? Now, I want you to understand, this is on the back of her ear, kind of like on the back part of it. So as I cut that off, I kind of shaped it a little bit because it was a stalk. So you can't just cut it straight off and then sew it together because it'll bend the ear back this direction. So we kind of took a little piece of that keloid and shaped it like a circle and then sewed it into place. All right? Now the big question is, Dr. Brock, what does this have to do with the laser? Hang on, I'm going to show you, okay? This is the back of her ear. It took 42 stitches. So we had to separate the ear, pull the inside. You can actually see the actual ear piercing as it went through. We took that out and then put it back together, sewed it, and now is this thing going to grow back? And so this is where everybody told me, send me a picture in 3 weeks so I can make fun of you. I said, okay, I'll send you a picture in 3 weeks. So this is about after a week, and this is just looking at the side, so you can't really see how good this is, correct? Okay, so there it was. There it is now.
Wow.
Okay, now there's a little bit of a bend, there's a hair around her ear up there. That is, right there is where it was. I sent this picture to everybody, and they're like, what did you do? Like, I'm not gonna tell you. And they're like, no, come on, what'd you do? She lasered it every other hour for 5 minutes with violet and red, and the keloid never grew back, and it healed just like that within 2 weeks. So now, I got a lot of plastic surgeons, they're like, using chemotherapeutic medications, they're doing all kinds of stuff to reduce the size of the keloid, and they're like, I can't believe you cut that off and it didn't grow back. The laser actually helped the tissue heal appropriately. We know it does this because the literature says it activates mitochondria, it allows things the DNA to not fragment or duplicate or delete, and it allowed it to heal purposefully. She didn't really know what was going on. She's just like, will you just please cut this thing off? But it changed her life because now her kid will touch her again. You see, that's the cool thing. It didn't grow back, it stayed just perfect like this. And that's her ear from the side. Again, notice the awesome dolphin tattoo. And so that's what she looks like. It healed up fantastic. Now, I give you that as an example just because I want you to understand this laser did something for integrity of tissue. If it can do it there, can it do it in other places? The answer is yes. We're going to go look at that. This is me making stem cells. This is the interesting part. We know that we can program the laser frequency to activate the stem cells. So as we harvest them and spin them down, we actually will shine the laser through the stem cells to activate them so that when they go into the joint or into the tissue, they will ramify in the niche of the tissue and start to turn into that tissue faster. How cool is that? Now we're going to get to what we would call emerald or green or 532 nanometer. It's the pretty green color. So what do we use all these for? And how are they being used clinically? Here's a paper on depth of penetration and looking at fat tissue or adipocytes, okay? So a while back there was a plastic surgeon that was doing bariatrics or doing some liposuction, and he treated low back pain with laser. And what he noticed was that everybody he was treating for pain, when he did liposuction, the fat just came out almost like a running liquid. It didn't come out in chunks. Have any of y'all done any liposuction? It comes out it comes out chunky. Well, we noticed that when we put the laser on somebody, it came out like liquid, almost like milk. So we're like, this is odd. This was years ago. This was with red. This wasn't even with green. This was with red. So it was so interesting enough that we started running some studies on this, okay? And so Mayo Clinic did some studies, and we found out that not only through through functional MRI and other imaging, we know that it goes into the brain, and we know that it goes probably all the way through the body, but we know it goes at least 8 to 6 inches really well, okay? So this is a fat cell, and this is a cluster of fat cells over here. And so the question is, what do you want to do when it comes to getting rid of fat? I mean, do you want to destroy the fat? Do you want to get rid of it? Because if you do, here's what happens. If you get fat, if you just put back on more caloric, if you start getting bigger again, the fat cells in other places will just get bigger. And your armpits are in other places, even though your waist may stay more narrow. So what we wanted to do is create a system where it just opened up the fat pore and allowed the internal contents to come out and then close. So that if you ever got bigger again, it would just go back to where it's supposed to be, okay? So if you could just play the first, actually, this is what they look like when they've been deflated, okay? You can kind of see that cluster over there and over here. But we wanted to do it under electron microscopy. Can you play this first video for me? Oh, it should go. Okay, so look, this is the laser being shined real time. You can see this is the adipopore opening, and the contents are starting to come out of the fat cell. And so when that happens, if you'll watch over here on the right, they start to shrink, and then all the triglycerides just go out into the periphery. And what's interesting is, not only do we not destroy the fat cell, but the internal contents are utilized as energy. So, the question is, the big question, what do fat cells really do to your body? They create leptins. Has anybody heard of leptins? It creates adiponectins, and it creates inflammatory cytokines. So, I started doing this on patients and they would lose 6-7 inches. It's really not difficult for them to lose size. But what I was more interested in is what started happening to them metabolically. Did it do anything for diabetes, insulin resistance, heart disease, triglycerides? Because if you, according to the literature, if somebody reduces their hip to waist ratio, if it gets better, then what happens? Their chances for heart disease goes down. Their chances for diabetes goes down. So I'm like, you know what? Let's start measuring some things. Let's collect some data. Let's do some research. So, all research starts with a research question. Then you do a beta study, then you do a real study, and then you start drawing some conclusions. You answer your research questions. So I'm thinking, man, if I could get these to open up, and if I could get rid of leptins, because a leptin will come out of your fat cell, go up to your hypothalamus and say, quit eating, because you have too many fat cells. But the hypothalamus will do this neat little trick where it says, you know what? I'm kind of tired of listening to you, so I'm going to be resistant. So you still make leptins, but it doesn't stop your hunger, and your hunger goes up. Now, where do all those extra leptins go? Another quiz question for the day. Where do they go? They go right to your joints. And it causes synovitis, and it makes your knees hurt, your fingers hurt, your hands hurt, and it causes brain inflammation. And all of that extra stuff snafus into insulin resistance. And insulin resistance makes your triglycerides go up. It gives you a fatty liver. It makes your good cholesterol go down. It changes your aldosterone so your blood pressure goes up and you retain sodium. And it oxidizes your LDL, and it makes your platelets stick together so you're a greater stroke risk. Now here's what's interesting. What has gone up since COVID? Stroke risk, thrombosis, platelets sticking together. A lot of people are getting what's called phospholipid antibodies and platelet antibodies. So when you lower the fat content, by the way, what is the most prone population for COVID complications? The obese. So think about this for a second. The obese are inflamed. They're making more platelet aggregation. They're more prone for clotting, and they're more prone for deterioration of tissue. And so as soon as that infection comes in and it makes a cytokine storm, you've already got a little one going anyway from being obese. So it just pushes it even faster. And you clot even easier. And so it creates complications that much faster. So I'm like, hey, can losing or contouring the body, not just ripping fat cells out, but taking those contents out and then changing leptins, changing insulin, and changing inflammation, can that do anything to help the resilience of my patients that are just sick in general? And the answer has been a resounding yes. I'll show you. So actual fat loss. This is what 4 inches of fat looks like. It's about 5 pounds of fat. You can see it right here. In the United States, it is FDA cleared for fat, or not body, not weight, but actually fat loss. Okay, because you got to remember something. You may lose fat, but you still may not lose a lot of weight because we tend to see people get an increase in lean muscle mass. So there's an offset there. So what we started measuring was this. On every single patient, we were measuring leptins, which you can measure in the blood. We can measure C-peptide, which is a monitor for insulin. Adiponectins. So adiponectins come out of fat cells and they stop inflammation. So when you get leptin resistance, your adiponectins drop and your fat, its adiponectins are not protective anymore. They drop down to nothing, okay? A1C, what is that? That's your long-term marker for diabetes. And then we had to look at some thyroid stuff because obviously we didn't want to do anything to try to reduce size if somebody had hypothyroidism. It doesn't make a lot of sense. We just did that as a way to kind of monitor patients. We use a laser-based system, and this is what we ended up getting. Our C-peptide reduced 41%. This was just in a beta trial, okay? This was not anything that we did. This was just like a precursor study. This is a retrospective review. Our leptins, 38% reduction. Adiponectins went up 13%, and our A1C went down 0.2 to 0.3 points with 12 sessions over the course of about a month or 2 months with just green light, our Emerald technology, over the places where there's the most amount of fat cells. And we found that it's reducing visceral fat and subcutaneous fat. So the researcher in me says, I wonder what would happen if we actually did this over the liver. Could we reduce fatty liver disease? That's something that we'll be looking at in the future. But if you look at this individual right here lost 13 inches total. Okay, 13 inches. So now on average in our program, we're getting between 8 and 24 inches. And our average patient is losing between 15 and 60 pounds. So this shows we basically measure everything with we don't just use a measuring tape. You can do it in different ways, but we decided to use a laser-based system where it'll actually hit you with a laser, will make an avatar out of you, and it'll show what you look like before and after. So it measures you. This right here is the circumference of the waist. If you're looking down on somebody from the top down, and the red is where they were, and the green is where they are after treatment. So you can see where the inches were lost the most. And so the great thing about what we're doing with the Emerald is we can turn different diodes on or off. So some women don't want to lose like fat cells in certain areas, but they do in other areas. For instance, maybe they don't want their breast tissue to reduce, but they want maybe their hips to reduce or their thighs to reduce. So we can turn on the diodes in different orders, and we can find out that in the waist or in the abdominal area, they lost 2.6 inches. In the narrowest part, 1.9 inches, and in the lower part of the waist, 2.5. And when you add all this up, you get an enormous difference in the way somebody looks. And so we can actually see this is an individual. The red is where they were, and the green is where they are now. Now, one interesting thing we found, this patient right here is an individual that had multiple sclerosis. Okay, so in 100% of our patients, their posture improved in 100%. Head forward posture, it improved. Why? We don't exactly know. But we also did some work on her chin, and she has transverse myelitis, which is multiple sclerosis of the spinal cord, right? Her lesion shrank by about 38%, according to the radiologist. And she got better motor function, and she got better balance, and she got better bowel and bladder control. And we were just shining it, again, we were shining it through her chin, but it was going through her neck as well, okay? Really cool stuff. Lots of research in the future. So what we're doing is we're taking high leptins and we're reducing them when we open up that fat cell and we dump its contents out. Now, what's another thing that happens whenever you open up fat cells and the content dumps out? What's inside those fat cells? Toxins. That's where you store the majority of your toxins. So as we open those up and they dump toxins out, we're noticing that people are detoxing, which is really cool. In our practice, what we do is we give some binders. some bentonite clay and some charcoal and some chlorella. We give them that, and they do fantastic. And then we hydrate them significantly, and it flushes out hormones, and it flushes out a lot of other stuff that they've accumulated in this fat. So we get these leptins and we measure them, and we measure adiponectins and the angiotensin system, so their blood pressure was changing, their leptins were changing, their hunger was changing, and their overall inflammation was changing. And the other really cool thing is their brain fog was reducing. Because when you get inflammation from fat and it goes through the blood-brain barrier, it starts to activate glial cells, and it makes your brain kind of start to shut down a little bit, and you get brain fog. That's what brain fog is. So we noticed we can actually measure those markers too. All of those inflammatory markers that come from microglial cells were dropping as well. So we started thinking, we're like, man, we can use lasers for healing tissue, we can use lasers for reducing fat tissue, and then we can actually use lasers for stopping the inflammatory cytokines as well. So it's working on multiple components of physiology. And this is really, I put the references down there for everybody to see. And this is what happens when we're obese, and then we get this obesity complication. What do fat cells do? We end up getting all kinds of insulin resistance, leptin resistance, inflammation. So it's in the literature. So I already knew this was in the literature, and I already knew what we were doing with fat, and I already knew what we saw under electron microscopy. So I wanted to start measuring these things. And the theoretical component in the papers and what we were seeing clinically came together by looking at the labs. The labs demonstrated that what we were trying to accomplish, we were actually accomplishing. So we're not talking about just losing fat anymore. Now we're talking about giving somebody the ability to sustain tissue. And how important is that? So what we're finding out now is if you have more fat cells, you have a greater chance of neurodegenerative diseases like dementia. You have a greater chance of liver failure, kidney failure, and all kinds of things. So this has gone way beyond just looking good or looking better, which everybody wants to look better, but if you can get some other benefits out of it, it's just that much better, right? I told you about adiponectin. I didn't make as big a deal of this as I did the leptins. If you don't make adiponectin, every fat cell in your body is going to be constantly inflaming you, constantly. You're going to be under a constant state of inflammation, okay? And I've got pictures traveling all over the world, and I just take pictures of like crowds. And what I've noticed is, I'm from Texas, we have the most refined foods in the world. And they're all modified, they're all hybridized, and we have the biggest people on earth. Texas does, I'm not lying. But then I come to Europe and I go to different places and everybody looks completely different. It's weird, as I go in different places, what I'm saying is, our environment is changing. It's not conducive. We have an inflammatory world now. So that's why this is kind of important technology. I'm noticing now that even in the places in the world that weren't as big, they're starting to change as well, because food is changing everywhere, okay? In the United States, there is no such thing as native grain anymore. It doesn't exist. It's all hybridized. So what your immune system, if you grow up in the States, your immune system, what you inherited from your family, you don't have the immunity to that grain or those foods anymore. So when you eat them, even if they're organic foods, they're still creating a certain amount of inflammation. In certain parts of the United States, we've had major flooding, so we have major mold overgrowth, so we have mold toxicity, we have pesticides that are being used, our food is not the same, so everybody is becoming inflamed. So we notice that whenever we actually reduce the size of fat cells and we increase the adiponectins, we are protecting people from their own environment. And there is a global shift right now to where things are growing that didn't usually grow, crops are changing, and we're having to do things to keep them alive, but it's not as conducive for our own health as it is for some other things. So when your adiponectins drop, it'll affect your pancreas, your liver, your brain, your blood vessels, and your immune cells. I told you that when we used our emerald and we got people to actually reduce fat cells, our adiponectins went up, our inflammation went down, and people felt better. Some people, she had a question, what happens if people don't take their fibers? We just noticed this. I have a lot of chronically ill patients that get this, And so they tend to detox very harshly. And so I just did it in my practice because they were already having problems. The average person doesn't have to use one. But the people that are really ill, we started using it. So we just started using it on everybody. Usually not anything. As a matter of fact, in the FDA studies, there were no side effects. But they didn't do it on chronically ill patients either, okay? That's a good question. So when we look at obesity, we know that you're inflamed, and we know that you are now having hyperleptinemia, so your leptins are going up, your adiponectins are going down, you're getting insulin resistance, which means you're making more triglycerides. When you get insulin resistance, it turns your triglycerides, or it turns your sugar into triglycerides, and you get fat storage. And when that happens, your uric acid goes up, and that's the beginning. 7 out of 10 of the top 10 killers in this world that are non-accidental are from an inflammatory mechanism. Cancer, diabetes, heart disease, vascular pathology, their underpinnings are all from uncontrolled inflammation. So we have to do something to stop that. This is a big part of it. A big, big part of it. So it's like so cool whenever we can make somebody look better, feel better, live longer, and hopefully stop the mechanism deteriorating a little bit faster. And you can see right here, when we don't do this, and we have a change in food intake, one of the things that gets really, really congested and it doesn't work well is your brain. Right now, the rate of dementia, by the time you're 70 years old, 1 in 5 people will start having dementia. That's not good. We have laser-based therapy that we know through the literature right now that is increasing brain health as well. So it's not just about fat loss and wound healing, it's also about activating the brain so that it doesn't lose its volume. Brain cells don't undergo mitosis, so once you lose a brain cell, it's gone. So if we activate the mitochondria and stop inflammation, degenerative disease slows down. That's cool. Violet and green does a really good job. This is it, insulin resistance. So more fat, leptin resistance, insulin resistance, your HDLs get bad, your triglycerides get bad, your blood pressure gets bad. What's that? That's a recipe for what? A heart attack or a stroke. It activates your sympathetic nervous system. So that does what? It increases your need for beta blockers, or it does this, it creates anxiety. Another thing that was really, really astonishing is and we didn't even start calculating this till a little bit later on, and that is the rate of anxiety went down tremendously. And do any of y'all do heart rate variability testing? Our heart rate variability testing was tremendously better from sit to stand and doing various activities. Really cool. And then who doesn't have a little bit of adrenal stress these days? Pretty much everybody does, right? So adrenal maladaptation changes. So when we actually change all of these hormones, insulin and brain, we notice that people go into a more parasympathetic state, their heart rate changes, their digestion gets better, their detoxification gets better, and the ability for their T cells to turn into the appropriate type, we noticed gets better. So it activates your spleen to change T cells into the type of T cell that you need. So, and we can map that out now too. So we're sitting there, we're like, oh my gosh, look at all these things that we're doing just by decreasing fat and actually lasering something. So we can change weight, we can change metabolic function. If we can change weight gain and insulin, we can change cognitive decline. This is right out of the literature. This isn't something that I made. So when we change all of this stuff, and we change weight, and we change adiposity, mitochondria gets better, you heal. Inflammation goes down, you get better, you heal. Cognitive dysfunction, it actually changes. Right here is talking about the blood-brain barrier. It starts to heal the blood-brain barrier because a lot of people have a leaky blood-brain barrier because of inflammation. And if you've had a head injury, your blood-brain barrier will open up within 20 minutes, and so will your gut. So as soon as somebody's had a head injury, one of the first things we do is we start lasering. We've also found this, that as we laser over this area for adiposity or fat cells, we're doing things like altering SIBO. Do y'all know what SIBO is? Small intestinal bacterial overgrowth. So as you eat certain foods, you make a lot of methane and a lot of hydrogen, and these are people that bloat every time they eat. So we're seeing people lose bloating. They don't have to take rifaximin or medications to stop that. It's better known as irritable bowel syndrome, really is what it is. Our irritable bowel system, it's just changing significantly. When you change irritable bowel, you actually increase the ability to use the bathroom. So another thing that we were really noticing is that constipation dropped significantly. So bowel frequency was more regular. A lot of our female patients, and I'm just saying female patients because I think we had it was like a 3-to-1 ratio. The average amount, the average duration, most females in our study, or when we were looking at, they would use the bathroom once every 48 to 72 hours on average. But after the study, most of them were using the bathroom at least once or twice a day. The biggest thing was the bloating reduced significantly. I mean, tremendously. To the point where people were like, I can eat this food again and I don't bloat. A lot of people they were getting food avoidance because they would bloat. And we don't like that because when they would come in and get remeasured, we were measuring bloating versus actual fat. So it was like, man, it's really nice when the bloating goes away as well. Just really cool stuff. And then the microbiome, the biggest thing that we noticed out of all of this stuff is the microbiome with fat reduction and using green laser, it completely changed their microbiome. All the people that wanted fecal transplants, they didn't have to get them. So we can now take a stool sample and measure everything in the microbiome, and all of the microbiome that you need, all of the different types, the plantarum and all that you need to reduce fat, it actually increased that level, and it decreased certain levels of bifidobacter that would make you gain weight. So we're like, wait a minute. This is opening up a fat cell and then also killing off the microbiome that makes you inflamed, sick, and gain weight, and it's increasing the flora that makes you lose weight. Last story, real quick. You do know that fecal transplant, dysbiosis, all that stuff got really big about 15, 20 years ago. There was a research scientist in the States that wanted to lose weight, and so he inoculated himself with a certain strain of flora or bacteria, and he lost 50 pounds just from doing that. So now we know which bacteria in your gut do which things and perpetuate which diseases. We can monitor it while we use laser. Really cool stuff. It's not that you have to do that in your clinic, but while we're looking at it and then somebody wants to come and talk about it, these are the cool things that we're seeing. I don't want to talk about just what we already know it does. We already know it reduces size, it reduces inches, it makes you look better, it makes you feel better. But what are the other things that are really going on? Stopping pain, increasing brain function, changing your gut, and all of the things that are happening inside that make you sick, it's starting to change. I can't tell you how many diseases start in the gastrointestinal system. What percentage of your immune system is in your gastrointestinal system? 80%. 80%. So inflammation is big. If you can control gut function and make it healthier, way, way better. So here's our obesity. Make it simple. Here's the need. We know that if you're overweight, you're going to break down that knee, right? But that knee breaks down because obesity via leptins already makes all of these things that I talked about, and that causes synovitis, and it allows your own weight to break that joint down. That's why your knees hurt more than your hands, but your hands still hurt. I have a lot of patients come in, they're like, look, my knees are breaking down because I'm a little overweight. And I'm like, well, how about your hands? They're like, oh, that's just arthritis. And so when they start losing weight, it's amazing. They're like, I can move my hands better. I'm like, why do you think that happened? They're like, well, you explained the leptin thing to me, and you explained inflammation to me, and so I just don't think I'm inflamed. I don't feel as inflamed anymore. And you're like, that's exactly right. When you reduce your BMI and you reduce fat cells, you will reduce inflammation. That is the big takeaway from this. Because 7 of the top 10 killers are based on sustained inflammation. The most prone population for COVID is obesity. Living a longer life, means reducing fat cells and not having as much inflammation. There's a lot of things that can make inflammation, but this is a big one. And I also, so my father passed away when he was 46. When he was 46 from heart disease. So what do you think I'm concerned about? Heart disease. I did PhD work in heart disease, and I started it at 46, the same year my dad died. And so going through all of the research in heart disease, the one thing I found out is, it's not just your lipids that kill you, it's when they get inflamed and they oxidize, then they kill you. Your lipids can be pretty high, your cholesterol can be pretty high, but if it's not oxidized, it doesn't get you as bad. There's 3 inflammatory markers that make fat oxidize. It's called lactophosphoesterase, myeloperoxidase, and CRP. And in our studies, and when we're looking at our emerald patients, our CRPs are dropping tremendously just with fat loss. Now, if you look at that, maybe those patients are not oxidizing fat as much, and so their blood vessels are not closing off as quickly. Another study that'll be so much fun to do. So if you can change fat, you can change arthritis. If you can change fat, you can change dyslipidemia. If you can change fat, you can change hypertension. And if you can change fat, you can change diabetes and insulin resistance. And that is the big story that I want you to take home today. That's why when you go over to that booth and you start looking and you're like, hey, okay, cool. These people are losing inches, but you're gaining life. I think that's important. Because I want you to look good, but I want you to live longer. Fair enough? And last but not least, if you let this go on long enough and you get insulin resistance turns girls into guys and guys into girls. What does that mean? Well, if you're a guy and you have insulin resistance from fat, it makes your testosterone aromatize into estrogen and you get gynecomastia. If you're a female, it takes your estrogen and turns into testosterone and you get PCOS. A tremendous problem right now in the United States and probably in other areas. So we're changing hormones as well. And this is right out of the literature. Fat causes, how many 45 to 50-year-old men that are gaining weight have low testosterone? 50%. So the thing to do is just give them testosterone, right? Have them lose some fat cells first, and then what you'll start to see is their testicles will work better, and they won't have as much estrogen, and you don't have to worry about prostate enlargement as much either, because we know the aromatase that causes that abnormal conversion is what makes your prostate enlarge. It also does the same thing for increasing the chances of breast cancer in females. Do not become insulin resistant. If I could say there's any one thing you don't want to be, it's insulin resistant. Higher protein diet, get laser, lose some weight or some fat cells. So this is everything that we would go through in our program, and everybody puts it together differently, but the biggest thing is this. Just stay healthy. I mean, this makes it to where you don't have to have maybe an absolute perfect diet, but a good diet. You don't have to take 100 supplements, you can take a few. We use a few peptides, but we don't have to worry about our diabetic patients progressing as quickly when they start actually losing adipocytes. When the leptins go down and the C-peptide goes down, their entire life changes. We're using lasers right now. Light is medicine. And that's what it's becoming. That's why, if you're a researcher and you're doing stuff and you're noticing this, you're like, I don't have to put a synthetic chemical in somebody to do a certain job. Some of the medications for weight loss are pretty harsh. So that's pretty much what I have to talk about. I'm Dr. Brock. Come back and see us in the booth if you want to talk.